At Government Capital Corporation, our entire mission is public finance. It's what we do. Since 1992, we have funded thousands of financings totaling billions of dollars. Our vast network of capital market legal and financial resources ensure you will receive very competitive, cost-effective financial solutions. Government Capital is committed to a tradition of service excellence, and we look forward to providing you the unparalleled level of service you deserve. From large complex finance structures to small everyday equipment financings, we will provide the right solutions for your ESD.
Welcome to this webinar presented by the State Association of Fire and Emergency Districts and the National Association of Emergency and Fire Officials, or NAEFO. I'm Monty Olson, Executive Director of NAEFO. Today's webinar qualifies for 1 hour of Texas State required commissioner training. This webinar is certified by our educational sponsor, the V.G. Young Institute of County Government, part of the Texas A&M Agri-Life Extension Service. At the end of the program, you'll be given instructions on how to apply for your certificate for 1 hour of training. This webinar will give you an opportunity to ask questions. You can call in, text in, or email your questions at any time during today's broadcast, and here's how. The phone number is 512-251-8101, or you can email safed, S-A-F-E-D, at texas.net, or text 512-567-0857. Of course, normal text messages rate supply. Or you can use the chat function on the right side of your screen. The American Rescue Plan passed in March gives special districts such as fire and emergency service districts access to federal funds to offset the effects of the pandemic. On May 10th, the Treasury Department issued preliminary guidelines about how states, counties, cities may use the billions that are coming their way. Our guest today, Karr of the National Special District Coalition, has been in the forefront of winning federal funds for special districts. Cole is going to tell us how special districts fit into the new guidelines. Welcome, Cole.
Thank you, Monty. Appreciate that. And good morning, everyone. Just a brief overview of the National Special Districts Coalition. We are a national coalition. It's the only national coalition that is advocating for specifically special districts in the country on the Hill and offering best practices amongst associations representing special districts in states. This is primarily through California, Colorado, Florida, Oregon, Utah, as well as South Carolina and Wyoming. And we've been working a lot with our national partners as well that have special district stakeholders, such as NAEFO and Texas Safety. And we've been advocating on COVID relief for about a year now together. And here we are. Finally, we've got this. We've got some funding flowing, and I will share a little bit about that funding. We've had a bit develop over the past 2 weeks, including those interim guidelines that have been released, as Monty mentioned, and a little bit more about exactly how the funding is going to flow. So I'm going to share my screen, and we'll go ahead and get started. All right, so a couple things that we're going to talk about. We're going to talk about just the basics of the program, and I'm going to go a little bit more in depth on the broader part of the program, not necessarily just for fire and emergency districts. And the reason for doing that, we're going to make sure that when it comes time to advocating, you not only know how to demonstrate your need, but you also know what you're working with and who you're talking to. And we'll get a little bit more into that in a second. And of course, the considerations when it comes time to actually take advantage of these funds and use them. We're going to talk about how to advocate for them briefly. And then there are really not a lot of alternatives in here that will probably be useful. I do apologize. This was an extra point on the slide I modified from a different one, and that we won't be talking about funding alternatives. That's mostly for utilities. So just a basic overview of the ARP, the Coronavirus State and Local Fiscal Recovery Funds. The money was released and available on May 10th. That was last Monday. And then we had an interim rule for preliminary guidance that was actually published this past Monday on May 17th. So everything that is in writing is how this program will operate. There will be future guidance in the time forward through frequently asked questions and additional documents that Treasury will put out to help guide districts and states and county cities how to use the funds. And that is an important part. As I take some questions here lately, I will say if there are questions that we get that aren't defined within the guidance, we're going to take that question that's been asked and we're going to submit it to the Department of Treasury for that future guidance, for those future FAQs that come out. And if there is other questions here that I may not be able to answer right off the bat, I'm going to get those to Monty and Cliff to make sure that we can get a good follow-up. Anywho, so the guidance is there. We've got the actual rule. Every city, every county, every state, over 50,000 population for the cities have received their money, or they will be receiving their money through their request now. It's the first tranche. Half of the monies have been distributed this month, and they will be distributed the other half next year in May 2022. So the only ones that have not been able to access this funding directly, that are directly eligible, that is the non-entitlement units of local government. Those are population 50,000 and fewer cities. Non-entitlement units of government do not include special districts. That is a common question that is asked. We are also not consolidated governments, as you will probably read in other portions of the guidance if you happen to read that. The special districts are special purpose units of state and local government, and we are eligible for transfer authority. And we'll get there in a second, but the distinction, any use, not special districts. So there is an open comment period for this. And we encourage taking a look at the questions and the documents. And these are some of the questions that we will be answering from the National Special Districts Coalition, mostly through webinars just like this and conversations just like this, through questions that are asked. We're going to submit those questions and we're going to be able to answer those too. So this is a great time to ask these questions and make these contributions here. And then we will be sure that we can, by July 16th, get all of this to get to the Treasury so that we can make our public comment and make sure that all questions and concerns are addressed moving forward. So I mentioned that the first tranche is already out. The next time will be May 2022. The only time that a state won't get two tranches, they'll get it in full tranches, is if the unemployment rate is 2 points higher than it was in February 2020 right now. There are a couple of those exemptions out there, but generally speaking, half of the funding is already out and will come next year. Primary dates that we're going to be referencing and mentioning from here on out in the program, all of the eligible uses of funds and revenue losses, so on and so forth here. Premium pay, what we'll get into, it's all dated back retroactively to January 27th, 2020. That was when the first public health emergency was issued in the US. Also, for March 3rd, March 3rd, 2021, you can cover any costs incurred from that date forward. That was the declaration. And you can also use these for revenue loss back to the state, as well as premium pay back to March 3rd. All of the coronavirus the coronavirus fiscal recovery funds are going to be able to be used through December 31st, 2024. And the performance period, that's when all the reporting is done. So really, the scope of what we're looking at here is January 27th, 2020 to December 31st, 2024. And I understand that most of our attendees today, all but two of them, are from Texas. So I've put a couple of stats here for Texas sprinkled in throughout. The $350 billion has been broken into two funds, one about $195 billion for states, the remainder for localities, for the three tiers of localities: counties, metropolitan cities, and then the non-entitlement units. A lot of money is coming to Texas, about $26 billion. So lot on the line. I understand, and we'll get into this again during a very brief advocacy piece later, that the state of Texas will be considering how to utilize this fund in the fall. So there's still some time, but we'll talk about how you need to be talking to your counties, your cities in the meantime about some of your impacts and how to do that here. So point of note here. Couple things to think about. Just from the sheer interest of how this is in existence, this is definitely a unique opportunity for districts to take advantage of certain projects in the event that you are able to qualify for infrastructure, or if you're able to actually use some of your revenue losses toward infrastructure and other needs that are actually going to need to go through the NEPA process, the National Environmental Policy Act process for the environmental review. If you use solely Treasury funds that you receive for these projects, you don't have to go through NEPA. That is a very big exemption. You'll still have to go through State Environmental Quality Act processes, but NEPA, you got an exemption from. Also, in what would be considered the buzzword now, disadvantaged communities and other disproportionately impacted communities for COVID-19, there are going to be expanded uses for this. This is going to touch, again, still more on the infrastructure piece, but there's going to be a focus on the ability to use these funds in these regions. It was kind of a dicey process for the Treasury to get this included in there. We weren't sure how they would be able to fit this in, but apparently they have. So again, that's primarily for like drinking water and wastewater infrastructure. But the state and local fiscal recovery funds, they can be transferred. And this is important because although special districts were not included in direct allocation, we were included as part of a transfer fund. So the law actually allows any state, any city or county to transfer their funding to nonprofits, private nonprofits. They can transfer them to like ports and harbors, anything that is a public benefit corporation set up for the transfer of passengers and cargo. But then there's also in there a piece about special purpose units of state and local government. And in the Treasury guidance, we actually got a call out. There is encouragement in the Treasury guidance for states and cities to efficiently and effectively use the funding to collaborate with other units of government that were not directly allocated funds. Special districts got it, like I mentioned, a special shout out here specifically. Of course, this is not an entire exclusive set, but fire, water, sewer, and mosquito abatement districts got the special call out. But all special districts are going to be eligible for this transfer. But there is definitely even better news from the law that there is in this guidance encouragement to work with special districts. This was absent throughout the entire CARES Act process, and it's how we all ended up most of us ended up in an issue where we were unable to access CARES Act funding through the Coronavirus Relief Fund. So great news here. So just again, a couple things to consider when it comes time to advocate, and we'll get again into this a little bit more, but talk to your community. Think about how you can coordinate and cooperate with your elected officials when it comes time to thinking about some of the projects that you may be able to use. Think about how it would be portrayed publicly. And then also think about how you're going to be able to reasonably explain and get the public to understand why uses of funds for your district are necessary. For fire and emergency districts, that's not going to be quite as hard to do. We're all on the front lines here of COVID-19 and responding. So pretty low bar there, pretty good. So eligible use of funds, this is the kind of the bulk of the project here, the program. There are 4 areas of eligible uses of funds. I'm going to cover them all. Anything that had to do with costs incurred for public health and safety, hazard mitigation, and prevention of COVID-19. This is a little bit of what was in the coronavirus relief fund, that some of the key provisions within that have been taken out from the coronavirus relief fund when it came to crafting this rule, such as more broadly unemployment costs. That is no longer part of the fiscal recovery funds. However, there is an expansion into vaccination clinics. So if your district has played a role in any kind of vaccination efforts, tracing efforts, these are things that are going to be considered a response to the pandemic and eligible for reimbursement. We can cover revenue loss, we can cover premium pay, which is essentially like a workforce bonus for certain eligible employees. We'll get into all of this here in a moment, but also water, sewer, and broadband infrastructure. Not going to be as applicable to fire and emergency districts, but again, I want to, in the interest of understanding the what the uses of these funds are for governments where we're going to have to go and ask for funding from, I want you to be able to understand what their uses are and how they may be spending their money as well. So, as mentioned, mitigation and prevention activities is now part of the public health response. There's actually a full list that is offered from not just vaccination programs and testing and isolation, PPE, sanitization, but also it's expanded into if you had to enhance a public health system, if you had to put in a capital improvement project for the enhancement of your facility to accommodate the needs to respond to COVID-19. So that is an extra piece that's really good. That's going to be good for emergency response as well as especially hospitals and healthcare districts as well. And then finally, there are ventilation improvements as well. That's more strictly lined up for quality of the air and circulation in preventing COVID-19 and the spread. Any enforcement of public health orders, as well as public communication efforts as well, that your district has had to do to put forward prevention efforts like public safety, public service campaign type, wash your hands, signage, that kind of a thing. Public communication is a piece that is able to be reimbursed as well. So that is the health and safety part. If you had any kind of behavioral health, from mental health to domestic violence resources and services that you offered through your district, that's also something that is considered certain elements of reimbursement. And also, if you did anything to focus on underserved areas that have like disadvantaged public health areas, medically underserved communities, if you did anything for additional outreach, it kind of falls under the public communication to those communities to make sure that they were covered. Again, another emphasis of use under the public health response. Also, these funds can be used to address the downturn in the economy and the effects of that. Primarily of interest broadly to cities, counties, are household income assistance. There's ability to add like a stimulus payment in some cases if a state or county decides that that is something that is going to be a qualified use and a reasonable use of funding for their community. That's a household assistance program. Same thing for household utilities and for rent coverage. That's another household help for individuals. Also, small business grants can be used through this. Again, it's kind of like the PPP, the Paycheck Protection Program, but different, fewer strings attached here. But there is an ability to grant out funds to small businesses. And really, it's just large, broad latitude. Whatever the general government services are that have been impacted because of the economic downturn, those are also things that could be reasonably justified, passed, and used for funds. And then also the tourism industry, restaurants, so on and so forth. Those are impacted industries that may be able to receive some assistance as well. Okay, revenue loss. This one's a little bit more complicated, and I gotta tell you, I've read this section of the guidance about 5 times. maybe more. And every time I read it, I get something different out of it. It's very difficult to wrap your mind around how Treasury frames this and how they intend for the revenue loss to be calculated. I anticipate there to be an addendum to guidance under frequently asked questions and further documents released on this, because it's part of it's very unclear. And how you calculate your actual revenue loss and how you project your actual revenue loss moving forward. Here's how you're going to work with revenue loss. You're going to base everything on fiscal year 2019. When it comes to that, that's because it is the most recent fiscal year that preceded the pandemic. Using fiscal year 20, you're going to get part of the pandemic in there, and that is going to throw off your numbers. So using fiscal year 19, the end of it, your fiscal year, not the federal government fiscal year, using that point in time, you're going to measure forward a projection of how your district would have fared. So 4.1% of annual growth is the benchmark that the Treasury has put out for projecting your potential future growth from your fiscal year 19 end. So say that you had your annual growth for the next 3 years at 4.1%, you would do compounding 4.1% every year. Here's a guide for this. This is an actual Treasury document graph that's in there. So June 19 is what they used here, and what they did, they projected out their what would have been their revenue losses at 4.1% growth every year, because that was the national average of annual growth for state and local governments for the preceding 3 years. What you can also do as a district, if you want to go back and look at 2015 to 2018 and look at your average annual growth through those years for your revenue losses, and it's higher than 4.1%, you're able to use that number that's higher than 4.1%. But here's where the confusing part gets. The 4.1% and whatever the annual growth that you use, that rate's relatively simple. But what Treasury is saying is you can project what your potential real revenues could be, and what you could use for your revenue loss number is that difference between what you actually get and what you would have gotten based on that 4.1%. The deal is, when it comes time moving forward, when you're doing your reporting requirements, you're going to have to reconcile moving forward what each point in time, the end of the years for 21, 22, and 23, what those real numbers were. And those are going to be your real revenue loss numbers compared to that 4.1% benchmark. So that's a little complicated. It's going to take some foresight and planning to make sure that you can stay within the parameters of the law. But nonetheless, this is the benchmark of how to actually calculate your revenue losses. And because we're already past December 31st, 2020, you can use one point in time already. So that is revenue loss. If you are able to take revenue loss, if you've had revenue losses and can demonstrate them, you can use the funding that you use to backfill that on pretty much anything that your district would have done for its general government services. So these examples here are as if it were for a city or a county. So a city or a county has the responsibility of health services, environmental remediation, and roads anyway. They would be able to use the revenue losses that they receive for backfill on these programs. They can't go out and do any kind of new special program with the precise dollars that come in, but they can use it on what they would have used the funding on anyway. So for special districts, what this could mean is if you put off like a cardiac respirator, for instance, purchasing on that, or that was just something that you were doing anyway, this is what your revenue loss funding could be used for. Nothing that's brand new and outside of the realm of your district services. So yeah, I would recommend, if you haven't already, start calculating all of this, putting all of these documents together. Premium pay for essential workers. As fire and emergency responders, y'all are essential workers. So this is something to pay some mind to. Essential workers that are eligible under the Treasury guidance are those that have been responsible for the continuity of critical infrastructure services. And this also includes public health, public safety, and all of those responses, those responders. So they are also able, if you have a contractor through a third party, if those workers fall under those categories as well, they are also eligible to receive premium pay. Premium pay is $13 per hour in addition to whatever wage your employee that qualifies for this it would receive. So it's essentially up to a $13 bonus of sorts, but the maximum per employee is $25,000 a year. So there are some restrictions on this. When it comes time to think about how much of that $13 an essential worker would get, there is a cap before you'd be required to publicly state and submit to the granting agency, and probably the state in this case, why your employee that is receiving any more than 150% of an occupational average for your state through the premium pay program. So this is because it's meant to provide the essential premium pay to those that are low income, that have not received essential workforce pay, that have been on the front lines, such as there's human infrastructure involved here, like childcare workers and meat packing facility workers. These are also considered essential workers under the guidance, and they typically haven't received this kind of pay over the course of the pandemic, yet they were essential to the continuity of our economy. They are the ones that are going to be more likely to not hit that 150% threshold of the total state average occupational rate for hourly wages before you have to report on this. I've got the figure here for Texas. The average annual wage for all occupations and hourly wage is $25.19. The 150% of that threshold is $37.78 an hour. So if you end up paying one of your employees in Texas $38 an hour, that exceeds the 150% threshold, and you will have to submit a written explanation of why that achieves the goals of the program to provide assistance to disadvantaged communities and to workers that are socioeconomically disadvantaged, so on and so forth. You can find all of the calculations here on this website. It's through the Bureau of Labor and Statistics. And you can not just see it for Texas, you can see it, I know there are a couple from Washington as well. You can see this for Washington and other areas across the state, across the US as well. I will mention, and I neglected mentioning this a moment ago, when it comes to calculating other payroll and benefits, there is a provision also that payroll and benefits for substantially dedicated employees, such as public health and safety workers, there is the ability to backfill some of, or to reimburse, I should say. The district could get reimbursed for some of the hours that they worked directly responding to and mitigating the spread of COVID-19. So it's not a blanket payroll coverage like it was under the Coronavirus Relief Fund for all public health and safety staffs. What the guidance here has offered is that any public health and safety employee that has spent a number of hours responding and mitigating COVID-19 Those hours that were spent, if those have been documented for COVID-19 purposes, that is the portion of the payroll and benefits, a share of such, that the employees' payroll and benefits could be backfilled through the district. So say that it was a 10-hour day and a first responder went out from a fire district to cover COVID-19 issues and respond to COVID-19 calls for 8 hours of that 10-hour day. 80% of that day's wages and benefits would be covered. Now, there's a nuance here where if there's a unit of employees that is solely dedicated or primarily dedicated to the response and mitigation efforts for COVID-19, then in that case, all of your payroll and benefits for the staff are covered, regardless of how many hours were worked doing so. So those are probably primarily going to be ambulance, your EMS, healthcare workers in emergency rooms and ICUs. Those kinds of units are going to be the ones with the employees that are able for the district to refill their payroll and benefits on that. And then again, water and wastewater infrastructure is a use here, and we were waiting to see what necessary investments were. And essentially, the way that this comes down to is a necessary investment in water and wastewater infrastructure is anything that a state, county, or city decides is necessary, but it has to fall under the state water and clean drinking water revolving funds. So the eligible uses need to be considered under there. We had a question last time about fire hydrants and the infrastructure there and whether that would be considered necessary. Unfortunately, the answer is no. There could be a little bit of a nuance here. If it's just the fire hydrant itself or the connection itself, it would not be able to fall in line under the clean drinking water or the water revolving funds. However, if there is an issue with a pipe that is used for clean drinking water that actually funnels the water to the fire hydrant, then you would need to work with the entity that has that pipe to potentially use the infrastructure funding to fix the problem. But solely fire infrastructure for water use, unfortunately, generally wouldn't fall under drinking water or clean wastewater state water revolving funds. I don't know why it's hard for me to say. But that's just a little bit on the infrastructure piece. The infrastructure piece is going to be what is going to make it very difficult to advocate and ask for funding from your cities and from your counties, especially if you're in an area with aging infrastructure and backlogged projects. There's wide uses for this fund for cities and counties. And then, of course, broadband infrastructure, if you're especially in a rural area, there might be a public broadband connection and connectivity effort. If there are investments to be made in these cities and these counties, especially in the rural areas, that might be a competing issue when it comes time to ask for the funding. Just something to keep in mind. This isn't going to be as big of a deal as a water and wastewater, but nonetheless, broadband use is an eligible use of funds under the necessary investments. Okay, so how do you access it? And we went over this a little bit 2 weeks ago, but we're gonna really briefly hit on it again, and then we're gonna turn it over for some questions back to Monty. But regardless of anything at this point, the way that districts need to position themselves, if they haven't already, for federal funding, you need to get a system for awards management number, and you need to get a data universal numbering system number, a SAM and a DUNS. This is what Treasury is requiring of all governments that are receiving the public funds from the the coronavirus fiscal recovery fund, so that they can track the where the funding goes and how it's used. This is somewhat standard. The Treasury will use this in the future. So even if there is no funding accessed through this program, these are good things to have. And make sure that if you do already have them, that they are up to date and they are complete. These do lapse every year. So make sure that the SAM number is definitely up to date. And do keep in mind that it could be up to 3 weeks for the SAM number. And I can say with 19,000 entities that are able to receive the funding under the law, it's the first time that the Treasury has put out a program to every single city, county, and state ever. So it's a little unprecedented, and they're probably a little backlogged. That 3 weeks could be generous. So keep in mind that it could take some time to process both of these programs. So it could be more than a few weeks and more than a couple of days. But these are your links. This is also available in a PDF that Cliff and Monty have and can send out. But these are the links to register, and there's a phone number there for your DUNS. Okay, so now that we know how to access or how to use the funds, before you even go and start advocating and asking the state how to use the funding or how to access the funding, excuse me, you need to make sure that you've got everything put down on a sheet. I've been recommending a 3-part report so that you can demonstrate not just you can demonstrate your need. You can have everything aggregated and have a little bit of proof for that, when the time comes and you're asking your state legislature or Governor Abbott or Governor Inslee for the funding to be shared with special districts and do your special districts. So part 1 of this 3-part document, this is just a brief rundown of some of the items, the big ticket items that are eligible for the use of funds for the health response, but eligible payroll expenses, again, that's the public safety workers that have a dedicated time to responding and mitigating COVID-19. That time for them, for those hours that have been calculated, that's an eligible payroll expense. And then the units that are substantially dedicated, the full payroll expenses. Put that on one of your lines. Also calculate your premium pay with that 150% cap in mind. And then go through, and if you can document all of your receipts, all of your invoices for everything else that's eligible, this is just a blip here. Your PPE, sanitization, any kind of testing or vaccination efforts, those capital investments as well for infrastructure for increasing the need to accommodate COVID-19. All of these are items that are to be covered. Again, eligible payroll expenses on this do not include sick or FMLA time, not this time. I will say separately, not part of this, there are now tax credits, payroll tax credits that are available for quarters 2 and 3 this year in place of that. So if there are paid sick leave that have been voluntarily provided to employees that have been sick, exposed, that have had to take time off, and you paid them for it, you can submit that through the IRS, and they will be able to administer, they would be able to administer that tax credit, but that's just for quarters 2 and 3 of this year. Do not include that on this document. That is a different program. Again, your revenue loss statement, that very nutty way of calculating it, definitely calculate your loss as of December 31st, 2020, include that on there, and anything else you can do dating back to 19. Use that 4.1% or whichever is higher, the 4.1 or your average annual growth from 15 to 18 or 17 to 19 for your fiscal years. Do that, provide the adequate documentation to back it up. When it comes time to document your relief, include this as part of your statement. And then also any water and wastewater infrastructure projects, if by chance your district did have those, just include those documents in there. total all of these together, 1, 2, and 3, add them together, and that is what you can demonstrate your need to be when it comes time to ask for it. And that's your top line statement. And then you use that to tell your story. Again, as we mentioned 2 weeks ago, make sure that you can give that top line figure of how much the fiscal impact is. But again, if you've had any kind of employee impacts, any services in your community, if you've had any kind of how you've gone above and beyond to serve your community and alter your operations to accommodate the needs for COVID-19, this is something to consider in telling your story. Numbers are one thing, but a story is another. So consider that when it comes time. And then also you got to talk to your state elected leaders as well, because these are who you're going to be advocating for your funding from. Cliff will be able to talk a little bit more about how to access the funds and how the safety is going to be taking the approach to the state legislature to make sure that special districts are able to access these funds, fire and emergency services districts. A number of our states in the coalition have gone to their governors and have done all-out pushes to their state legislatures doing all of this. They've been telling the stories. They've done the studies. They're making 10% total asks of state fiscal recovery funds that have come out based on the research that they've done on fiscal impacts, but also they're using the human elements to tell the story. So be mindful of this and keep track of Texas and Washington and how the legislatures are shaking out, what your governors are doing and how they are positioning themselves. Be advocating, be talking to each one of your state representatives, your state senators, email, write letters, make phone calls to them, do it to your governor's offices as well. Make sure that they know that you as a fire and emergency services district have issues, and you have issues that have been unable in large part to be taken care of because you're a special district, and special districts were not treated the same as cities and counties were last year. Tell those stories. Make sure they know. They're not going to know unless you call. So do take those steps, go through, do those contact me forms, send in those letters. What I also would recommend, I understand many of the health procedures are not as stringent as they were now in Texas before. So make that field meeting, call up your state legislature, get a field rep to come out and visit you, get the legislator to come out and visit you, meet the employees, tell them the story. It's impactful, and that can definitely build some support in that fashion. And as mentioned, simultaneously be communicating with your city and your county officials that where your district serves. So what we found on this is communicating with your counties, especially the needs that you have, explaining to them how your district operates, how you're funded, some of the services that you've had to put out for COVID-19. They may not actually fully understand or be fully aware of all of this. So just communicate with them, tell them your story too, but tell them that you are asking if, I understand Cliff, through my conversations with Cliff, there will be a state ask for funding for districts from the state level. Tell them that you're advocating for the state level, that you're involved in making the asks of your state legislators and the governor. But they also have the ability to transfer these funds as well. And for the time being, to not defer any local programming, any local relief funds, you're taking the state ask to help them as well. Ask them to join you in your cause. On my other portion of my job, I am a regional affairs coordinator in California, in the Central Valley. I work with 8 counties in my region. I took that message to each of the county executives and some of the supervisors there. And what we found out of the 8, 6 of them actually joined our support coalition because after having those conversations about districts, what they are, how they're actually operating, and telling them that we are not asking them for funding yet. we're doing it through the state so that we don't take away from them. They jumped on board. So this is a very useful tactic. It's something that I strongly recommend doing. And then in the event that the state does not open funding for special districts, make sure to go back, and now that they have an awareness of your issue, make that ask down the road. Of course, as mentioned in Texas, it sounds like it's not going to be taken up how the funding will be distributed from the state side or allocated on the state side until the fall. So there's some time to start doing this. I recommend doing it now. And then, of course, just do your power numbers. If you can form a local or a state, a county coalition to do so, strongly recommend it. And then also invite for those tours, engage your community, start telling your story on social media, engage the community that you work with, do the newspaper op-eds and letters to the editor. We had one last year that I'm aware of that was circulated pretty regionally. It was pretty decently the way that it was circulated around portions of the state from Kyle, Texas, the chief there at Hayes County ESD, one of the ESDs there, wrote an op-ed, and it was published in a few of the papers around and about the state. Recommend doing that again. We collaborated with Cliff to do that. So if you haven't thought about doing that already, be thinking about it. And then, of course, we're happy to help in doing so too. So there are a whole slew of advocacy resources. There are best practices, sample documents. There are templates as available as well in this Dropbox link. That is a case-sensitive link. So if you are writing it down right now, make sure the NSDC is capitalized and everything else is lowercase. Not only is the documents for sample documents and templates in there, but I also included a couple of special reports on the American Rescue Plan in there. We're going to have another one come out on Tuesday on this whole topic directly. And then also I have in there the allocations for every city and every county that has been distributed. So you can see that the non-entitlement units of government are not yet available. Those are going to have to be determined at the state level by June 9th. So that's kind of a good resource again, so that you understand when it comes time to moving to the counties and cities, when you're talking to them, you have a good understanding of how much money they are working with and how much they have available to them, let alone transferring to you. And then again, the same thing at the state level. There's the state level document in there as well. Yeah, and then there's a little bit, just briefly, there's some FEMA public assistance funding that's been they've been boosted. I recommend using the fiscal recovery fund on this. FEMA public assistance, as you all very well know, can be quite the task and quite the hassle. The other program, the fiscal recovery funds, those are going to be more direct, and you have more control and more power over them. But just a reminder, there is FEMA public assistance on here. There's also a boost of funding through the ARP for emergency management performance grants, as well as assistance for firefighter grants and SAFER grants, about $400 million total in all of those programs, and then additional food for emergency food and shelter program if your district was involved in any kind of food distribution as well. That is something that you can apply for through FEMA with the project minimum of about $3,300. But again, something that could very easily be used through the fiscal recovery fund as well. But nonetheless, these are additional resources for you. And then again, billions in public health highlights. So that is the program. That's a little bit of what we got. And Monty, I know we got about 11 minutes for some questions and answers. Happy to take those now. And also, this is my contact information on the screen. That is my cell number. So you're able to call that or text it. I prefer an email though. It's a little easier. If you can, I can shoot over some documents for you that way. But feel free to email and call if there's anything beyond this. Monty, I'll turn it over to you.
Thank you very much, Cole. The presentation links to the Dropbox folder for advocacy that Cole just shared with you. And eventually, recording of this webinar will be available on the SafeD and NAEFO websites. So we do have time for a couple questions. Just to remember, here's how to reach us. Phone number 512-251-8101, or email safed, S-A-F-E-D, at texas.net, or you can text us at 512-567-0857. So a couple questions here. How much change do you expect, Cole, in the final rule?
I don't expect really any changes. The interim final rule was submitted for publication on the 17th. So the program, it's in the register. It's pretty well final. There might be a couple of tweaks. I don't expect a lot of changes. The only changes that we would see would be more in the form of clarifications, for instance, on that revenue loss piece and how complicated it was laid out. I don't expect anything to really change on this, which is a huge improvement over the CARES Act and how that was rolled out. So not much in the way of changes.
Very good. We hear about billions going to schools, but this is different from the funds you've been talking about, correct?
For schools and what I just outlined, correct. This is not for school districts. There are other programs, billions, for schools that will be administered through the Department of Education, not the Treasury. So these are all for states, cities, counties, and then those three entities, four at the state level with tribal organizations that are able to utilize the funding if transferred.
Very good. Can you use ARPA funds to cover costs before March of 20? All right, very good.
No. All of the payroll expenses, the premium pay, it all goes back to March 3rd, 2020. And everything else, as far as preparatory, all the other items, those go back to January 27th, 2020, when the first public health emergency was issued.
If your district revenue went up, are you ineligible for all ARPA funds?
If your revenue went up, no. The only thing that you would be ineligible for because you couldn't demonstrate it would be the revenue loss feature. So if you have expenditures, if you still did PPE, sanitization, anything of that nature, that you're still very well eligible to do that, and you're still able to provide premium pay for your employees that are eligible. And if you do have an infrastructure project, you're able to use that as well if you're able to get the funds.
A question about that premium pay, just to clarify, you don't have to have already paid your people the premium during the pandemic to use the money for premium pay?
Correct. So this is a new program, and the $13 up to $13 an hour per employee is in addition to anything that has already been remediated, remunerated is how it's pronounced. So correct. It's something that's new.
Okay. And could you unshare your screen real quick?
Oh, yes, of course. I apologize.
No problem. Can you use funds to reimburse volunteer districts for stipends? And there's a couple more that kind of relate to that, but let's start with there, and I'll hit these others that are kind of related there.
So my understanding of the way that stipends work for these are primarily, I'm going to guess, volunteer districts, Monty?
Correct.
So the way that it has been framed in conversations that I've had with a couple of the fire protection districts that I work with, if it falls in line with if you can delineate it, those hours that have been worked in responding to COVID-19, if there's a way that you can determine, and I hope it was documented, whether you were responding to a COVID-19 call or a potential COVID-19 call, and you received a stipend for that call, those would be the reimbursed abilities. If it were something else, not reimbursable.
Okay. What if employees spent money out of their pocket for things like PPE? Can they then be reimbursed indirectly through these funds? They'd come to the district and then we would reimburse the employees.
The way that I would handle that is make sure that the employees have those receipts and we're able to, in a formal process, submit their expense report to the district, have those expense reports on file, and then include that in your reimbursement, in your ask. If you're able to achieve these funds and you get the reimbursement and you have that used, you have that document ready, you can pay that employee for their expenditures that they made for PPE. But make sure that you have the documentation.
All right. And then kind of a last set of questions here. Who does the accounting reporting if you get the money? Do we have to report directly to the feds or to the entity that transfer the funds to us? And if it's the entity that's giving us the money, is there a form or process established, or is it really up to that state, county, city to figure out what that process is?
So this is kind of a benefit of sorts if you're able to get the transfer funds. Those who are receiving transfers just really need to talk to their county. The county is going to be responsible, or their city or the state, whoever they're getting it from, they're going to be responsible and bear the burden for all Treasury reporting. Okay. So you will need to work with of course, be a good steward, be a good partner, make sure that you would go through, provide all the documentation and all other items that you would want to have reported anyway. Just hand those off to the county, city, or state, whichever received the funds. You'll probably have to sign an agreement, like I forget what they're called, indemnification agreement, to do all of this anyway. But you as a district will not have to report directly to Treasury.
All right, very good. That's probably good news, as you said then.
Oh yeah.
So,
yeah, unless you have a very difficult county to work with, but government.
That's right, and we're government too, so here we go.
Yeah, county government.
All right, well, that was the end of the questions that I received here, so thank you, Cole, and thank everyone out there for joining us today.